Hello, Dr. Webster. Welcome back. Our topic now this week is diabetes. Diabetes is rampant. I've shared with you already how it's the insulin resistance. For some reason, your cells get covered over with certain types of bad fats, and that prevents the insulin from being able to get into the cell. And so I've been doing my research on it, and a lot of the underlying causes of diabetes, from what we're learning, is inflammation. So here's an article. This is from PubMed, which is, I get all my stuff from the best medical sources I can find, and you're welcome to go behind me and research. So this is talking about turmeric. Now, turmeric has a long history. You know, certain societies use turmeric on a more regular basis than we do. I think a lot of us are beginning to understand the benefits of turmeric. So this PubMed article, huge article, talks about that. So I'm gonna share this with you. And again, these are things that I'm learning. I've been using turmeric for years. I use a very high quality, it's called UkonΣ, and I special order it. It comes from Japan, but it's the best turmeric that I know of in the world, and I do it for myself. And at this age of my life, most people my age would have a lot of aches and pains in their joints and stiffness and soreness, and all this is inflammation. And for the most part, I feel great. So I know this is a big part. So let's talk about it and how it relates to diabetes. So recent trends in lifestyle have shown the increase of diabetes and its complications worldwide. 300 million people or more will be affected in the world. That's a lot. Free radicals, another thing, inflammation, free radicals. Free radicals, ladies, are what age you prematurely. It affects your DNA, it affects the protein, it affects how your body heals and how you look. Free radicals form during the metabolic reactions, and if they're not scavenged, if they're not captured and neutralized, can cause even more problems. Turmeric is commonly used as an additive to give flavor, and that's all good, but it also is known to have a potent antioxidant. Again, antioxidant means good. Anti-inflammatory, absolutely. If you have pain and stiffness and soreness in your joints, you need a good quality turmeric. And then look at this, anti-carcinogenic, anti-cancer. Again, I'm on this path, cancer, heart disease, diabetes. What can I do for John Webster so that I don't get these diseases? And I think this is a big one. Okay, previous studies in mouse models have shown that oral ingestion of turmeric reverses many of the inflammatory complications and a metabolic derangement. Super. Okay, so here's a study. They did a study. It took 60 male diabetic patients. They've been a diabetic for less than 2 years, and they were between 35 and 55. So they separated these guys in two groups, 30 in each group, and both groups were taking this medicine called metformin. And again, I'm not a medical doctor, but both groups were taking metformin. And once they went into this control study, they realized that when they were policed or watched to make sure they took their medicine, in both groups, they had better outcomes. But they noticed group number 2 had better outcomes. Group number 2 was given turmeric along with their medicine. So I would never indicate that you don't take medicine, but this report shows that if you add turmeric to your medication, you get better outcomes. And so that was huge. Okay, I'm going to share some things with you. Oxidative stress plays an important role in the development of diabetes and cardiovascular diseases. Hyperglycemia leads to increased production of free radicals. Again, that the free radicals destroy the tissue. It tears down your body's ability to heal itself. Turmeric possesses typical radical trapping ability. So the free radicals, turmeric traps it and helps neutralize it. Remember, we said earlier it was an antioxidant. So turmeric in your body helps to slow down the damage that free radicals do to us every moment. So such good stuff. The addition of turmeric in the therapy resulted in improvement of the antioxidant status in group 2. That was the group that had it. So antioxidant, everybody wants antioxidant. Well, turmeric is the big one. In diabetes, increased in cholesterol, another part of the study, cholesterol. Everybody's on this cholesterol thing. I think someone told me yesterday the most commonly sold drug there is currently right now is a statin drug. And again, you take your drugs, you do what your MD says, but this article out of PubMed says that turmeric actually has a positive effect on your total cholesterol. So look at that. Again, this, I'm taking it, heart disease, all this stuff in my family, I'm taking it, and so far at this point I'm good. The addition of turmeric to the therapy resulted in improvement in antioxidant status. We talked about that. Okay, so turmeric administration may aid in the prevention of cardiovascular risk. You hear that? Heart disease? Turmeric administration may aid in the prevention of cardiovascular risk. Well, hey, you're talking to me. You're talking about somebody that lost his mother and uncle to heart disease massively. So inflammation plays a pivotal role. We talked about that. Turmeric supplication, yeah, there we go. Just over and over again, they talk about how it decreases inflammation. So it helps with the cholesterol situation. So I'm going to try to summarize it now. So therefore, turmeric exhibits some potent, again, anti-diabetic, antioxidant, and anti-inflammatory properties, which will be beneficial in alleviating complications occurring in diabetes. Along with other medicines, turmeric may be added to prevent or retard molecular complications of type 2 diabetes mellitus. So my comments to close here, again, I'm a chiropractor, I'm not an endocrinologist. If you have diabetes or think you are getting it, go get checked out by a medical doctor, get the right test done. If you are diabetic and you're taking your medicine, don't change anything, consult with your doctor. But this article says, without a doubt, taking turmeric helps your body have a better chance against all the damage that diabetes is doing to you. And so again, I've been taking it. I take a turmeric called UkonΣ. I get it from Japan. It is the best quality turmeric in the world, and I'm happy to share that with you. There's a link below. You can look at it. But I thank you for spending some time with me, and I'm going to see you again next time. Have a good day. Bye-bye.